Actually,
Part of what the problem that currently exists, the legislation that it went through, the executive order that went through for the fast food workers. So if you imagine Miss Gibbs trying to take care of her family, and I have to tell you, as the son of a home care worker, as we can all imagine, it's very difficult work to take care of people when they're in the most vulnerable stage of their life and incapacitated in many ways. And I often tell to encourage people about the pride and dignity of the work we do and how special they are to do that. I say close your eyes and just think of a member in your family that should not go near any patient at all, should never be in the care of another individual because they don't have the human capacity to do that. So if you imagine the work that goes into that, and then to find out, though, you could actually take care of your family if you were to stop doing this and to go and flip hamburgers. And it's not to denigrate the work that people to do, but when those are the choices, and at the end of the goal, the only reason you work at all is to make sure you can take care of your family, then you're likely to make those decisions. As far as our membership, the 80,000 are the home care workers. That is our largest category of the lower paid workers, but we also have workers that work in nursing homes and other areas that are also not making a living wage.
do you have any discussion for us relative to those individuals who have been with you for a while and perhaps are making $15 an hour after working their way up and working very hard in this industry? What do you envision for them? What about the compression issue? Have you given thought to that? Can you discuss that with us?
Yeah, I know this because one of the things that people don't know as far as my own history is that when I became a healthcare worker, the first job that I had was in housekeeping. And because of the union, I was able to go and formally get my degree and become a professional technical worker. And I know that as a professional technical worker, I never forgot where I came from and never thought that because I went to school and was blessed to get that opportunity to finish my education, that those who did other work that didn't command the same salary didn't deserve that. And so that I would say for our senior home health aides that are there at that moment will never feel, I believe, will never feel that, I had to pull myself up by the bootstraps and this person just comes off through a legislative pen in making the money. Rather than that, they're going to say it's about time that they're able to make a living wage to take care of their family. Now, it's certainly, human nature is different. It certainly would probably be different if we were talking about $40 an hour and an entree immediately into the upper middle class. But to wonder whether one should make a living wage for an honest day's work, I don't think that will be an issue at all. I think that rather than that, it will be a massive celebration about the fact that we can now move on to the next level and talk about now what are the educational opportunities that can allow me to make more than a minimum wage. I can guarantee you we have 450,000 1199 members in 5 states in the District of Columbia. I can guarantee you none of them aspire to make the minimum. They all aspire to make the maximum that they can make. And the minimum is just the road to getting to the other point. And I don't think anyone is going to want to deny their fellow co-worker or someone in a different industry the right to make a living wage.
Thank you.
Thank you.
Senator Savina. Thank you, Senator Martins. First, I want to thank Senator Martins for holding this hearing for the start of what I hope is a very robust discussion about how do we establish a living wage here in New York State, hopefully becoming the model for the rest of the nation. I want to thank you, President Gresham, for your testimony and for your leadership on this issue. And I want to pick up where you just left off.
Yes.
It is appropriately the province of government to establish the floor for workers. That's what FDR did in 1938, after one would say several hundred years of unions agitating in this country, but we started it there. 1938, the government established the floor. It has always been, though, the province of the labor movement to establish the ceiling, or to lift the ceiling. And so that's what I think, in answer to Senator Marchionne's question about what happens when we establish a rate change for entry-level workers and we bring everybody up, what happens to those above? Well, the collective bargaining table is where you will resolve that for workers who've been there for longer. But you also represent 80,000 people in the home care industry and several dozens of thousands in the nursing home industry, and in an industry by which your wages are held captive by the state government.
Yes, ma'am.
The Medicaid cap has had a deleterious effect on real wages for your members for a very long time.
Yes, ma'am.
So I'm thrilled that you're going to be part of this discussion, because in the next several weeks we are going to be engaged in the budget process, where I would imagine we're going to be handed a budget for the Department of Health and Medicaid that's going to be flat. It's going to be a zero growth budget.
Right.
And we're going to be told to accept that in that room, and then in another room being asked to approve $15 an hour that will affect your workers.
Right.
And at some point, the floor and the ceiling are going to hit there. Right. So what we need is your leadership and the leadership of all those in this room to help us lift the cap on Medicaid so we can improve and increase reimbursements to the agencies that employ your workers so that they can weather that $15 an hour wage increase. Are you with us on that?
I can absolutely.
Thank God.
Absolutely.
Because it's critically important that government help where it can. If we're going to establish the floor, then we have to be able to pay for that. We're going to have to provide. And that doesn't just apply to your agencies, the agencies that your workers work in, but also the nonprofits.
That's right.
And one of the other things that I hope that this robust discussion really spurs is that we as a government begin to re-examine the way we value social services.
Yes.
Not just in home care and health care,
That's right.
but in child welfare services and in human services and in shelter services. If we're going to attract people that want to commit their lives to those types of services, we've got to compensate them decently so that they can provide for their own families.
Yes.
This real, I think, travesty is that we have thousands of social service workers in this state who themselves are dependent on social services to make ends meet. We need to lift everyone out of poverty, establish a real floor for workers. Yelled at. Establish a real floor for workers and also acknowledge that there are additional costs to that. I don't think any of us are kidding ourselves that if we force employers to pay a higher wage, that there will be an effect on those employers. That's a fact. We know that. We understand that. But we all need to be part of this discussion. And I welcome you to the forefront of this fight. And I hope that when this legislative session is over, we have done something real for working people here in New York State.
Thank you.
Thank you.
I happily accept.
I hear you. She hears you.
E.J. McMahon is not.
I hear you. Any other questions? Tough questions from Diane Savino. Senator Perkins.
Oh, thank you. That's it. That's it. So thank you very much for your presentation and your extraordinary leadership over the years, for your workers and for our city and for our state, and for me personally as well. I like the idea of the minimum wage, so to speak, of $15. I don't think that's the answer. I don't want to ask you the question because you told me you have a policy person there.
Yes.
And the answer that I'm looking for is, what is the living wage? What is the living wage? I know we tried to do a living wage in the past when I was in the city council. But what would a living wage be? Not a minimum wage, not the floor, but what would it really be, a wage for the average working person to have a decent living? We're talking about 15 as a minimum. What would a real living wage be?
So I don't have the numbers in front of me, but I know that many people, and I'm sure you'll hear it later this morning and this afternoon, many people have done what they call a sustainability calculator, and there's analysis from every region of the state, looking at what are the costs, what are the housing costs, what are the child care costs, what are food and transportation costs, actually plugging all of those in to understand for a family of a particular size, what would it take just to make sure you can pay for all those things. You can get to work, you can buy groceries, you can pay for childcare. So I'd be happy to send you the link. I know they've done those calculations for every region, and I know 15 doesn't quite get you there. It is still lower than that sustainability level in almost every region in this state.
So I'm sorry you couldn't give me that number right now, but I'm glad what you did give me is what we really need to understand is that sustainability is what we're talking about, not just the minimum of what it takes, but what do we want working families to really have to sustain themselves in a way that is decent.
That's right.
And so I think that this is a great conversation as a step in the right direction, but we gotta move a little bit faster than this. And for us to be quibbling about this, I think is disrespectful to working families. That we all respect, that make it possible for all of us to be here. But we have to start talking more about a living wage, not a minimum wage.
Thank you, sir.
Anyone else? Well, Mr. Gresham, thank you very much. Thank you.
They're going through convulsions there.
Oh, is that what that means?
They did a good job. I just one other thing that my family and your family can relate to, although most people wouldn't think of it that way. When my parents actually left the South 10 years before they brought me and at that time, my sister, and it ended up being 4 of us. Once my father became a union member, he could afford 2 more children. But it's a true story. So the first 10 years we were raised by my grandparents. And so my father had been in the North and mother had been in the North for 10 years. When they brought me up, I understand the issue of immigrants speaking a second language, because until I came North, I thought I spoke English.
You learned you didn't.
But I had to learn it again, and even my teachers and my parents couldn't understand a word I said because I had one of the strongest, thick Southern accents that ever, so I felt that I had to learn English as well.
George, you did a very good job.
Well, thank you, sir.
You're fluent.
Thank you, sir.
Thank you very much. Thank you.
Thank you very much.
He's going to come up and tell us what we're praising.
Our next up today we have E.J. McMahon, who's the president of the Empire Center for Public Policy. Mr. McMahon, welcome.
Thank you. Good afternoon. Thank you for inviting me.
Thank you.
Thank you very much. The notice for this hearing is appropriately focused on the core question you need to consider in weighing Governor Cuomo's proposal. And that question, of course, is what impact would such a policy have on workers, employers, and the economy as a whole? I really think that's the question that needs to be carefully considered. I'm going to suggest to you in my testimony that I think there's some compelling evidence in support of the following answer. On balance, a mandated $15 an hour minimum wage would be a counterproductive policy with a negative impact. It would disrupt labor markets, reduce job creation, drive up prices, and chill the business climate. Now, as far as individual New Yorkers are concerned, I would suggest that the negative effects will be felt, ironically, most strongly by the very people this policy is supposed to help, and who I believe you want to help most, which is marginal, younger, low-income workers struggling to get or keep a foothold in our economy. On a geographic basis, the negative impacts are likely to be disproportionately concentrated in upstate New York, and will be worst of all, ironically again, in those upstate regions that are struggling most to retain and create jobs. My organization recently co-sponsored research to estimate the impact on employment of this policy, but before getting into those findings, I would like to create some context for this discussion, which I think is relevant to some things said earlier also. And there's some charts attached to my testimony that illustrate this. The historical path of the minimum wage, federal and state, adjusted to 2015 dollars, begins in 1938. The first federal minimum wage, which applied to a very narrow group of industries, actually, by today's standards, was in those terms 25 cents an hour, which in today's dollars is $4.20 an hour. During a 25-year period that coincided with the great post-war economic boom, the federal minimum wage, and this is in the 1950s until about 1970s, was steadily raised in stages and hit the equivalent of more than $10 an hour by the end of the 1960s. New York's minimum wage peaked in 1970 at the 2015 equivalent of $11.35 an hour. Over the last 50 years, New York State's minimum wage in today's dollars has averaged a little over $8.30 an hour over the last 50 years. By the way, if you stretch the comparison back 60, it's only very slightly higher. The current New York, the current New York minimum wage of $9 an hour is the highest New York minimum wage in 37 years, adjusting for inflation. Even discounting for future projected inflation over the next 6 years of 2.5% if the budget division is correct, assuming the same phase and schedule adopted by the Wage Board for fast food workers, a statewide minimum wage of $15 an hour in today's terms, as of 2021, would still easily be the highest in New York's history. A minimum wage of $15 an hour would be considerably higher than the minimums now scheduled to take effect over the next several years in our adjoining states. And while some cities elsewhere in the country, such as Seattle, have enacted local laws that have begun moving them up to a $15 an hour minimum wage, with some exceptions, such a policy has not been enacted on a statewide basis anywhere. As illustrated in Figure 2, adjusting for exchange rates and purchasing parity differences, $15 an hour is higher than the current minimum wage in countries around the world. Indeed, as of 2014, only 7 of 25 developed nations had minimum wages higher than $9 an hour, and none had minimum wages higher than $12. Most pertinent of all, from your standpoint in weighing this proposal, are the very wide differences in prevailing market wage levels in different regions of New York State, which, since you all know New York well, is largely reflective of the very wide differences in living costs in different parts of the state. Based on Labor Department data, as shown in Figure 3 attached, the median hourly wages for all jobs in different New York regions are lined up against $15 as well as last year's $8.75. Those medians range from a high of just under $22 an hour in the New York City metro area, which in the Labor Department's definition includes White Plains and Wayne, New Jersey, to a low of $15.30 in the Glens Falls area. Other upstate regions with median wages just above $15 an hour included Utica, Rome at $15.91, the non-metro part of Capital Region, Northern New York at $15.77, Central New York at $15.59, and Southwest non-metro New York, that would be out in the Western Tier, at $15.49. Even assuming these medians move in tandem at the same rate projected for total statewide wages over the next few years, a statewide minimum wage of $15 an hour would represent a very high percentage of the current hourly minimum wage throughout upstate New York, especially, again, in those regions such as the Southern Tier that have struggled most to create jobs. Which brings me to our own study. The authors of that paper, economists Douglas Holtz-Aiken and Ben Giddis of the American Action Forum, drew on 3 credible research models to estimate low, medium, and high impacts from raising the statewide minimum wage to $15 an hour, and the complete paper is attached to my testimony. Their key finding, as further explained in the paper, is that a $15 minimum wage phased in on the Wage Board schedule in different regions of the state could cause our job creation totals to be $200,000 lower at a minimum under the low impact estimate. And that depending on which other methodology was applied, and there's more details of those in the paper and even in my written testimony, the job impact could be as much as 432,000 jobs, or even in the high impact estimate, 588,000 jobs. Job losses would be smaller, but still more than New Yorkers should be willing to tolerate if the state was to set the minimum at $12 an hour. according to Holtz-Aiken and Gibbs. By the way, Doug Holtz-Aiken was unable to be here today. Unfortunately, we were unable, on the notice provided, to bring some of these economists into town, but would welcome a chance to do that some other time. Conversely, wage gains from the minimum wage would range from a high of $10.6 billion, that is, with the lowest job loss, it would be the highest net wage gain, $10.6 billion, to a low of just over $1 billion if the very high job loss estimate turned out to be correct. Based on national labor force data, our paper also estimated that less than 7% of the wages generated by a $15 wage would actually go to households in poverty. Now, advocates have suggested that a 67% boost in the minimum wage, which is what you're considering now, will ignite a purely virtuous cycle in which low-wage workers spend all of their higher pay on goods and services, resulting in a net boost to the overall economy. But there are two sides to that coin. A minimum wage won't generate higher incomes out of thin air. In fact, to a great extent, it will redistribute incomes, in some cases from one group of low and minimum and medium wage people to another. Consider how the $15 an hour wage scenario is likely to play out in just one important sector that touches many working families across the state. As of 2014, there were 11,370 child care workers employed in the 11 metropolitan areas of upstate New York, earning hourly median wages ranging from $9 an hour in Binghamton to just below $11 an hour in Ithaca. The biggest urban metros in upstate New York all had median child care worker wages below $10 an hour. That's as of 2014 median hourly wages. Now, obviously, in addition to being obviously important, child care is labor intensive, and licensed child care centers are subject to strict staffing levels. You can't automate child care. Given the figures I just cited, the imposition of a $15 an hour minimum wage inevitably will result in significant increases in child care costs for hundreds of thousands of parents at all income levels, some of whom are actually receiving government subsidies paid through nonprofit associations, which are a whole other area of discussion here. Mm-hmm. A significant raise for those 11,000 child care workers, and it would be, will require a significant increase in child care expenses for hundreds of thousands of parents and families. And as salaries rise for child care workers employed in licensed facilities, which is really what this count involves, families with informal child care arrangements also will need to pay more because of the prevailing wage increase. The most common assertion we hear in connection with the push for the $15 minimum wage, as Governor Cuomo has put it, is no one who works full-time should live in poverty. And of course, few would disagree with that. In fact, this is not a new concern in New York State. It was a desire to boost low-wage workers out of poverty that inspired Governor Mario Cuomo to successfully propose and initiate 22 years ago New York State's own supplement to the federal Earned Income Credit, a program that has enjoyed broad bipartisan support in Washington since the mid-1970s. By the way, the Earned Income Credit, as its name implies, is not public assistance. It is earned. It's related to work. For the single parent, let's count what the EITC amounts to. Counting the EITC and other state and federal wage supports and tax benefits, including child tax credits, which are refundable, which go to all middle class and working families, as well as supplemental nutritional assistance, better known in the past as food stamps. A single parent of 2 children employed full-time in New York at $9 an hour can collect total cash income of just under $35,000 a year, which works out at a 40-hour work week to $16.81 an hour. These figures do not include any additional benefits such as housing and child care subsidies or health insurance under Medicaid or the ACA. For the single parent of 2 in that example, a $6 an hour pay raise would result in a net cash income gain, when all is said and done, of $2.72 an hour, due to the phase-in reduction of the EITC and other means-tested cash supports I just mentioned. Now, it's one thing for this offset to occur in the course of a low-wage worker's natural progression up the pay ladder. It's quite another thing to assume that the only way to boost the incomes of these particular workers, who, keep in mind, make up just a subset of all minimum wage earners, is by forcing employers and their consumers across the state to pay billions of dollars more to a much larger number of workers, most of whom have family incomes well above the poverty line, in fact, multiples of the poverty line. If poor workers are your real concern, and they ought to be, by far the most efficient way to help them is through improvements and restructuring of the earned income credit, which to be sure really is going to require some cooperation or waivers from the federal level as well because of the way the earned income credit flows now. Because the earned income tax credit encourages poor heads of household to seek work without jeopardizing employment opportunities for anyone else. Now, you've heard it implied, and I guarantee you will hear it implied and stated by some witnesses following me, that economists throughout the nation, if not the world, have somehow now reached a broad understanding and consensus that increases in minimum wages have no negative impacts anywhere, anytime on employment. Let me stress, that's simply not true. Last month, for example, Professor Clemens at UC San Diego, who is one of the authors of one of the methodologies cited in our paper, published new research findings that recent federal minimum wage increases had reduced employment among young workers. His findings were not inconsistent with research published in 2012 in the Cornell University ILR Review, which found that New York's 2004 increase in the minimum wage was associated with a reduction in employment of less skilled, less educated workers. Now, economists are going to continue to disagree on the strength and significance of employment impacts from minimum wage increases. That is guaranteed. But in today's New York context, by far the most important takeaway from the ongoing debate in this field is this. The vast majority of minimum wage research published by academic economists on all sides of this issue has focused on wage hikes that were much smaller and much more limited in scope than what you are now being asked to approve in New York State. In fact, prominent economists otherwise sympathetic to calls for a higher federal minimum wage have pointedly declined to endorse calls for an across-the-board wage floor as high as $15 an hour. To cite just one, Professor Alan B. Kruger of Princeton University, former chairman of President Obama's Council of Economic Advisors, recently wrote in the New York Times that, and I quote, "A $15 an hour national minimum wage would put us in uncharted waters and risk undesirable and unintended consequences," unquote. As Professor Kruger concluded in his column, quote, "Economics is all about understanding trade-offs and risks.
I guess that's right.
The trade-off is likely to become more severe and the risk greater if the minimum wage is set beyond the range studied in past research. In sum, a $15 an hour statewide minimum wage in New York would entail some very big trade-offs, affecting the livelihoods and finances of millions of New Yorkers, some positively, others negatively. In a prolonged period of slow economic growth, such as the one we're now in, the loss of any jobs, much less a possible minimum shortfall of a couple of 100,000 jobs, is a risk you should not be willing to take. The research we've published and the work of other organizations and economists indicates that enacting the biggest increase ever in New York's minimum wage would indeed benefit many low-income workers, that is, those who still have work or can find it, at the expense of others, those who can or don't. The biggest losers in this equation will ultimately be stuck with the ultimate minimum wage, which is zero. Thank you very much, and I'll be happy to take any questions you may have.
Thank you. I appreciate it. You know, part of the concern that I have, and before I get started, you made references to a median wage.
Right.
Describe that for us.
Well, the median wage is the halfway point. 50% of the people make less, 50% make more.
Right. So when we're talking about a median wage in an area like Binghamton, Southern
Right.
Tier,
Right.
1540 something, I think is
Right.
what you said. That means that half of the population in that area that's working is earning less than $15.40 right now. The other half is earning more than $15.40.
Right. As of 2014, that's what they were.
So the prospect of a minimum wage increase and the effect on the business community in that area is something, obviously, that is of concern. Now, in preparation for this and for other discussions that we've had, I think we've all had opportunities to, I hope we've all had opportunities to research the issue of the effect of a median wage on minimum wage and what that ratio should be. But to the extent that perhaps we haven't, where is that norm expected to be?